I'll now hand over to Kirsty Dwyer, Western Sydney University's Chief People Officer, to open the series for 2025 and to introduce today's speakers.
Excellent. Thank you, Emma. And hello and welcome everyone attending today's session. And I hope that we will all learn and appreciate and engage in what will be a really interesting topic to open our Thought Leadership series for 2025. Western Sydney University's Thought Leadership series showcases the outstanding and groundbreaking work of our Western researchers that support the United Nations Sustainable Development Goals, or the SDGs. As the number one university globally in the Times Higher Education University Impact Rankings for sustainability for 3 consecutive years, we're really proud to foster research that drives real-world impact. In 2024, we also ranked number 1 in the world for gender equality, which is SDG 5. This is a critical area of focus for us, further solidifying our record as a global leader in gender equity. This series also complements commitments within our University Sustainability and Resilience Decadal Strategy 2030, which asks us to come together as a community around key environmental, social and economic aspirations that frame a vision for transitions to sustainable ways of living that leave no one behind. Today's topic is particularly fortuitous given we have just celebrated International Women's Day on Saturday just gone. This year, to mark the day, Western asked our communities to celebrate the achievements of women, connect through shared ideas and stories, and take action to advance gender equity. This marks the first in the series for 2025 and number 26 in the series, which was first launched back in November 2022. And we're going to be discussing the impact of menstrual health across the lifespan, so particularly topical. Menstrual and gynecological health conditions such as period pain affect around 9 in 10 people aged under 25. Endometriosis is as common as diabetes. Diabetes prevalence for those data-minded folks is about 1.5 million people in our country. Despite their prevalence, these conditions receive limited research and support, significantly impacting education, workforce participation, and overall well-being, not to mention navigating the health system when required and associated costs that women bear. My own personal experience coming to this topic today is I am at that stage in life around menopause, which is another spectrum of menstrual health. And I can deeply share the experience of trying to seek information and knowledge in order to manage the symptoms, the condition, and the emotions of that particular part of your life. So this is a really important topic for us to all engage in openly. Explore how menstrual health affects people across their lifespan and discuss strategies to reduce these impacts, promoting gender equity in education, employment and society as a whole. I'm really excited to introduce our speakers for today. Associate Professor Mike Armour is a leading researcher in reproductive health at the Nickham Health Research Institute here at Western Sydney University. His work focuses on endometriosis, chronic pelvic pain and menstrual health with over 120 published papers in the field. He serves as the chair of the Australasian Interdisciplinary Researchers in Endometriosis, is the academic co-lead of the Menstrual Cycle Research Network at Western, and an ambassador for the World Endometriosis Society. Professor Tania Fefolja is an expert in social and cultural diversity in education. Is based in the School of Education and Centre for Educational Research at Western Sydney. She specialises in gender and sexuality diversity in education policy, pedagogy and employment. As part of an award-winning interdisciplinary research team, Tania examines the experiences and support needs of young people who menstruate in school. She is also a recipient of multiple research and teaching awards. Finally, Dr. Michelle O'Shea is a Senior Lecturer and Interdisciplinary Gender Equity Scholar in the School of Business at Western Sydney University. Her research focuses on addressing gender and intersectional inequities in work, education and institutional settings, including health and sport sectors. Through her research and advocacy, she aims to create inclusive and equitable environments for all. Please join me in welcoming our speakers for today for what will be an incredibly diverse and interesting presentation and discussion.
Great, thank you very much for that introduction. And just at the start, I'd like to say that I wouldn't be up here if it wasn't for all the amazing work that my team and my colleagues and friends have done with me. So I'd just like to acknowledge, obviously, Tania and Michelle who are here, but also some of my other fantastic colleagues, including Dr. Sarah Duffy, Dr. Amelia or Millie Marden, our fantastic collaborators from the School of Education, including Professor Catherine Holmes, and I've definitely forgotten other people, in which I apologise. But I just wanted to say I'm lucky enough to be up here mansplaining to you, but I have had this amazing support, and I don't want to steal credit for everyone's work. So it's definitely a team effort, and I'm just fortunate enough to be the one talking about it today. So we're talking about menstrual health across the lifespan from menarche to menopause. So I guess we should probably start. What is menarche? Now, menarche is actually the first menstrual bleed. We used to call it the first period, but it's a bit contentious now because early on there is no ovulation in these early periods. And so most scholars now are thinking that without ovulation, it's not really a period, it's just a menstrual bleed. But for whatever definition you want to use, this normally happens around age 12 in Australia. It's getting a little bit younger as time goes on, so it's pretty early. And menopause is obviously the cessation of the periods. It's usually about 12 months after the last period. And so in between this time, there's usually a good 40 years, maybe a little bit less, where there's at least the potential for regular menstruation. And I think we worked it out, and I can't remember the figure off the top of my head, but it's hundreds of periods which occur, during schooling and during work. And so it's something that we've often overlooked as something to think about the impact of this. I say if you're tuned into this, I probably don't need to convince you that women's health is an under-researched, underfunded, and under-prioritized area. And so this is why when you see where, when I'm talking about potential solutions, you'll notice there's not a huge amount of research in I guess, innovative or novel solutions for things like period pain, especially. And it's just been because, unfortunately, a lot of the time, we know from our research, women, girls, and those who menstruate, when they go to speak to their doctor, their family, their friends about their periods, they're told it's just normal. It's just part of being a woman. Just get over it. Suck it up. There's lots of phrases like that. And unfortunately, this, like I said, it does occur sometimes when they're talking to their doctors as well. They're often told that they will grow out of their period pain. But the more research we do, the more we realize that that's not necessarily the case for many, many people. So what are the main issues for young women, girls, and those who menstruate especially is dysmenorrhea, so period pain. That's just a fancy way of saying period pain, heavy menstrual bleeding, kind of reproductively associated metabolic disorders like PCOS, and premenstrual syndrome and premenstrual dysphoric disorder. I'm not going to have time to cover all of those today, so I'm going to talk about the stuff that I know about best, which is dysmenorrhea and endometriosis. So primary dysmenorrhea is period pain which is caused by, we think, mostly changes in these particular hormones called prostaglandins. There's some other things involved as well, but it's mostly this. And this is period pain that occurs in the absence of any organic cause. So there's no structural changes in the pelvis, there's no disease there, it's just pain caused by these hormones. And what happens is these hormones, these prostaglandins, are bound up in the cell wall of the lining of the uterus. And when the period happens, these breaks down, the prostaglandins are freed to do their evil work, and they basically absorb back into the uterus, which if anyone's had a baby, you'll know the uterus is a giant muscle. And so what these cause is they cause these cramping sensations. This cuts down the oxygen supply, cause these painful rhythmical cramps. Obviously, I've never had a period, so I can't speak from personal experience. But from people I've talked to, this is exactly what they experience. So, the cramps come and go. They wax and wane in intensity. And we know that this changes depends on how much prostaglandins are being released. They're also absorbed back into the circulation where they move around the body and they cause things like neck pain, headaches. They cause diarrhea a lot of the time, period poops. So there's a lot of these pro-inflammatory markers happening. So this is the most common type of period pain by far, and probably most people who report period pain, this is what's happening. The other type of dysmenorrhea is called secondary dysmenorrhea, and this is where period pain is caused by something physical. And the most common cause of this in most women is endometriosis. And we'll talk about that a little bit down the track in a few more slides. So, what do we know about dysmenorrhea? We know it affects around 3 in 4 young women globally, so almost 75%. Primary dysmenorrhea is a diagnosis of exclusion, and what this means is that we can only say it's primary dysmenorrhea after we've done all the investigations to rule something out. There's no test for primary dysmenorrhea, but since our endometriosis affects around 1 in 7, we know that most of these young women, it's going to be primary dysmenorrhea. And in Australia, our research has shown that over 90% of young women, girls and those who menstruate under the age of 25 report having regular dysmenorrhea. And when they do have it, it's moderate or worse. So it's around a six, trying to get my accent right, about 6 out of 10. And so it's a moderate or severe pain. So this is not, a lot of the time, people think, oh, it's just something minor. It's not. That's quite a severe pain. And it's usually worse in the first 48 hours. But as I mentioned, it's not just pain. There's fatigue, there's problems sleeping, there's headaches, there's emotional changes. Just prior to the period, there might be breast tenderness, bloating. There's a whole bunch of stuff that comes along with this. It's not just pain. And we know that even when you get older, this pain or these other symptoms don't disappear. There often used to be this idea that you would just grow out of it. When you were in your 30s, you wouldn't have period pain anymore. It's very hard to get good data on this, simply because, as I said, we don't collect it. Unfortunately, it's never been a priority. But the data we do have suggests that it might decrease slightly as people age, but it's not that much, and it's certainly not disappearing. And not only does this have a huge burden on individuals, but it also has a huge economic burden as well. So menstrual symptoms in Australia are likely to be at least $14 billion a year in lost productivity. And we actually have another analysis coming out soon, which is, I believe, greater. And Michelle is going to talk more about the economic impacts. So the time that most young women start experiencing period pain is a couple of years after their first period. And this also happens to be the time when they are undertaking some of their most important schooling and exams. So I always think of it, if I'm sitting in class, we've all had those dreams where we're back in school and we haven't done very well. Well, if I'm back in class and I'm sitting next to someone like Michelle, we're both now teenagers again, I've got a full head of hair, and Michelle has her period and I don't, and we're taking the same exam, she might be in considerable pain. Is that not a disadvantage? And as a fact, we know from our research, absolutely it is. The majority of people report they struggle focusing and concentrating in the classroom. They say that it affects their ability to take tests and do assignment on time. And they often say, I need to take time off, at least a little bit, from school. So this is all happening at the most crucial time in their academic lives, where they're planning their future. And there's this disadvantage that they might be having. And we know as well that higher menstrual pain scores are more strongly correlated with this decreased academic performance and more likely to be absent. Not particularly rocket science. The more pain you're in, the harder it is to go to school. So this wouldn't be so bad if we had good treatments for managing menstrual pain and symptoms. Most women use over-the-counter medications like ibuprofen, paracetamol, and oral contraceptives. And these are the first-line medications put forward in guidelines. The problem is around 50%, depending on the research, say it doesn't work for me. So they're only getting either partial relief or no relief at all. And even more concerning, a lot of the time they're using dosages which are not right. So they're underdosing, they're not taking enough, or they're often choosing medications which are thought to be less effective, like paracetamol. The research shows that it's not really much better than a placebo, whereas ibuprofen and these other non-steroidal anti-inflammatories do reduce the inflammation that these prostaglandins cause. But most of the time, people just don't know what they should be using. And so this is where we start to talk about this concept of menstrual health literacy. Do you know what's causing these symptoms and how to manage them and reduce the impact on your life? We know things like heat, so I think everyone's probably tried a hot water bottle or a wheat pack or something similar. They do work. So do things like acupressure and gentle exercise are also shown to be effective management strategies. Yoga and breathing exercises can help promote relaxation and reduce muscle tension, and some dietary interventions like fish oil, ginger, and zinc have also got pretty good evidence to show that they might be beneficial. So menstrual health education, what can we do to improve menstrual health literacy, help young people understand what is a normal period? Because period pain is so incredibly common, when they speak to other people, they like to be told, oh, I had period pain. It's just normal. And when they speak to their mums are most likely to have had period pain statistically. So they say, well, I had that when I was a kid. So how do we know what is normal? Because we don't want everyone going to their doctor constantly. We don't want to be doing ultrasound scans, or we don't want to be doing laparoscopic surgery to check for endometriosis on everybody. So we need to start to figure out what is normal and not normal. When should we be seeking help? And there's been a fantastic tool created by Melissa Parker from the ACT Health called PIPA, which is a simple 5-question screening tool to determine how likely it is that your symptoms are normal or require more intervention, more checking up. So we ran a study a few years ago. We created a website called Menstruation Matters. You'll see the link there. It's freely available to everybody. And what we have on there is we have information about what is a normal period, what kind of symptoms are normal, what are abnormal, how would you know, what causes this? So we do explain things like prostaglandins. We explain what causes endometriosis. But more importantly, we pair that with some evidence-based solutions. So there's instructions on there on how to do yoga. We have a whole series of yoga postures, of breathing, dietary advice, backed up by evidence. And we found that when we tested this, we did a pilot study, that 43% of those participating visited their doctor because of our intervention. And the great thing is, over half of those visiting their doctor then got a referral on to a gynecologist. So these barriers to help-seeking behavior are reduced by this, a website which we created, as you'll see, on a shoestring budget. When you look at it, we are updating it, but it costs almost nothing to create, almost nothing to maintain, and it has these great outcomes. So we're just trying to figure out now, how do we spread the word about this? How do we talk about it more? And so this is just some idea of some of the things that we are talking about on the website. So this is a graphic. So it just helps explain, what is quote unquote normal and what probably needs investigating. And how does menstruation work? So a little cycle. Because we know, and Tania's going to talk more about this, that people overwhelmingly get biological information provided to them at school. Very little about management, very little about anything else. A lot of it is about how does your cycle work and how not to get pregnant, basically. And so, again, more of the information that we provided. So just very briefly, it's March. March is Endometriosis Awareness Month. As mentioned before, endometriosis impacts about 1 in 7 women and those presumed female at birth. It's the growth of endometrial-like tissue outside the uterus and other areas of the body. It's most commonly in the pelvis, but it's been found everywhere. Common symptoms include severe period pain, chronic pelvic pain, which is basically like pain that you have with your period, but when you're not having your period. Bladder problems, bowel problems, fatigue, nausea, and as you can imagine, a huge range of mental health impacts. Up until recently, a laparoscopic surgery was required to diagnose this. So as you can imagine, there's a huge wait list for this, and most doctors are understandably not keen on jumping into surgery immediately. Thankfully, now there's new technologies which are improving, MRIs, ultrasound scans. If you want to know more, there's a fantastic project called Image Endo run by some colleagues. The diagnostic delay is around 6.5 to 8 years. It is decreasing over time, which is great, but it's still far too long. Over half of the people report they had to change their studies somehow. People drop out of university, they change their program. When they go to work, they often lose their job. They reduce their hours. Many have to work part-time. So there's this huge financial burden on people with endometriosis. And at the same time, the treatments are very expensive. So they lose time at work, and then they've got to pay out of pocket for things like a dietitian, seeing an acupuncturist, the things that we know can help those with endometriosis. But again, it's a huge burden on people that are already sick and already might be struggling financially because of the impact it has on their work. And endometriosis in the workplace. During COVID, we did a survey in Australia, and we found that 1 in 10 people with endometriosis report that they've lost employment due to managing their disease. 1 in 3 have been overlooked for a promotion, and a huge amount have to take unpaid time off because they exhaust their sick leave so quickly. Our previous data suggests about 4 days a month sometimes they're losing. So as you can imagine, you go through your sick leave very, very quickly. And on top of this is the taboo nature of endometriosis. We don't talk about it. And I will let Tania and Michelle talk more about that. But these are just some of the problems that we see. And so our research is often looking at focusing on improving these things. Michelle and I have a fantastic PhD candidate, Danielle Howe, who's working on creating an endometriosis workplace support policy, and we're actually trialing that at Western Sydney at the moment. So we have the Endo at Western to help people stay at work, to give them the support they need, because overwhelmingly we've heard they don't want to be removed from the workplace. That removes them out of sight, out of mind. You should just take more leave. But that's not the answer. People want to work. They want to stay in work. They just need some support. And that's what we hear over and over again. So I think that's the end of my time now. So thank you very much for listening to me ramble on. I'm going to hand over to Tania.
Thanks, Mike. So I'm going to talk about a paper that we wrote around these issues and was not advertised, was published in the Australian Educational Researcher. Before I start, I just want to acknowledge the team. I mean, I'm first named on this paper, but the team has actually been led overwhelmingly by Mike. And, you know, there are numerous other people that have also been involved, and Christina Curry, and Catherine Holmes in particular, as well as Sherry and Kelly Parry, and other people that are involved as well. But anyway, just to start us off. So basically this paper is based on the results of an Australian survey of 5,007 young people aged between 13 and 25, and it examined their experiences of menstruation and dysmenorrhea. I'm going to focus on the qualitative results from this research, specifically those who responded to an open item about the question was, what can schools do better to support or better support students who are menstruating? As we know, menstrual management is recognised as a critical issue for young people, yet until recently it's been largely silenced around the place. In the research literature, little work focuses on the experience of menstruation in Western high-income countries, and even less is published around school education. So menstruation is a critical but generally underestimated issue for schools. Menstrual visibility is taboo, and concealment is often expected, particularly in relation to men and boys.
Discourses of menstruation as being unclean and requiring hygiene management may cause young people to feel embarrassed about their bodies. If mention of menstruation is deemed inappropriate, it can result in limited support from adults. The discourses around what constitutes normal menstruation are often influenced by outdated information, inaccurate messages and myths. So young people receive mixed messages about menstruation, ranging from being normal through to being traumatic, mysterious, secret, and a symbol of sexual maturity. And that's taken from Rubinski et al. Silencing of menstruation is apparent in the language used around it, which is often demeaning, dismissive, and even euphemistic. So the silencing around menstruation is problematic because it may cause young people not to listen to their own bodies. Period pain is typically understood to be normal and is, as Mike referred to, and is positioned as something that needs to be suppressed and tolerated. As a result, one is expected to continue with normal activities irrespective of pain and discomfort, and this pain or discomfort obviously should be hidden. In addition, young people are often unprepared for menstruation. The anticipation of menarche and having to manage menstruation can result in fear, stress, anxiety, shame, and stigma. These stresses are compounded for those people who experience early menarche and for trans and gender diverse people. Schools are in an ideal position to provide critical health education around menstrual health literacy. However, our research found that the provision of menstrual health education and support in some schools was limited. Young people reported inadequate information, saying that teachers focused on the biological aspects of menstruation, such as anatomy and function, but ignored the complexities. More importantly, information about pain management and the discomfort that often accompanies menstruation was not provided. Menstruation was largely positioned as unproblematic, and many participants felt that their education did not provide adequate guidance about what was normal and what wasn't. Hence, for some, critical signs of endometriosis were missed. Additionally, formal education about menstruation often came too late, well after menarche had occurred. So with these sorts of findings in mind, what can schools do better? And so I'm just going to talk, the rest of my part of the presentation is just going to talk about, we'll talk you through some of the voices of the young people and what they said in relation to the particular survey item related to that question. So the data were analysed thematically and 6 key themes were identified across the qualitative responses of the item. The first theme to be discussed here is sanitation. So many respondents felt that sanitation provided by their school could be improved. This not only related to period products and sanitary disposal bins, but hygiene-related products such as soap. So one 17-year-old young person from Victoria said, schools should have free pads that are easier to access. My school has them in the school nurse's office. So if I get my period during class and I forgot my own things, I have to go to the nurse's office, which sometimes is at the opposite end of the school, to get a pad and waste a good 15 minutes of valid class time. Another participant said, at my school, the sanitary bins overflow and used pads and tampons are spilled all over the floor. It's disgusting and makes me not want to go to the bathroom, which doesn't help when I'm on my period and have no choice but to bleed through my clothes or to go to the stinky toilet. Since the fieldwork for this study, government-funded schools have increasingly provided period products in school bathrooms. However, some jurisdictions have only done this in secondary schools, depriving easy access to primary school-aged students, while simultaneously disempowering them from attending to their own bodily needs. Another theme was around pain management. Respondents also felt that schools should teach about pain management and provide pain alleviation options such as hot packs and pain medications. A commonly raised issue was that of teachers not acknowledging the reality of the student's period pain. So a 15-year-old said, I'm diagnosed with endometriosis. The pain is excruciating and all I'm told is to shrug it off. I have had to leave mainstream schooling and resort to distance education because of this. And another student says, have better empathy towards girls in times of pain and better deal with the effects it has on working capabilities. That is, taking it into consideration in exams and allowing for time out if pain in classes, if in pain in classes, allowing permanent bathroom access and not locking bathrooms in class times. Another student said, I think they, the teachers, should realise that periods and the pain that comes with them is horrible, sometimes excruciating, and that sometimes girls need to go home for it and they aren't just trying to get a day off. And not everybody wants to take medicine, healthy reasons usually. I also think that we should be able to reschedule tests if we are on our period because I really cannot concentrate, but I don't believe this will ever happen. Adult constructions of young people within discourses of childhood which position them as irrational, irresponsible, and by extension not to be trusted, are implied by these respondents' voiced experiences. Teachers, thus, who are in low-key parentis, surveil students' movements and regulate student bodies through, in some schools, the locking of bathrooms, as was mentioned by that young person in the quote. This may not be perceived as problematic, as schools, like other public spaces, are constructed for the quote-unquote normal human, read male non-menstruator. However, it disregards students' human rights to sanitation. Period pain is not factored into the structural imperatives of the institution, but is privatised and positioned as a problem that must be addressed by the individual. Although schools have a duty of care to their charges, students are generally not offered alternative options to sitting tests or different ways to participate in classes, at least not in any conscious, institutionally regulated way. Having said that, since COVID, there is plenty of opportunity for schools, those sort of things have been set in place now and schools could actually start to implement those sorts of things. Like integrated learning. Another theme that arose was to remove the stigma around periods. So the importance of schools to remove the stigmatising discourses surrounding menstruation was another issue raised by respondents. Greater exposure in the curriculum and normalising discussion around menstruation for all genders was perceived as critical and seen to possibly help to destigmatise the experience. So one 17-year-old said, remove the stigma and shame around discussing it by openly discussing it and stressing that it is natural and not shameful, and so that people who have periods do not feel ashamed or embarrassed to ask for help if or when needed. Giving boys and girls the same information and normalising periods. Schools divide us when it comes to tricky subjects, quote unquote, because we are told boys don't need to know about it. They do need to know. Girls, especially those in younger grades, feel alienated from friends and feel as if they can't talk or ask for help because it's gross. This quote raises a critical issue. Menstruation and menstrual health are historically constructed as a girl's problem and as something for which the menstruating body is solely responsible for. Teaching that separates students by binary gender marks menstruation as problematic, consigning it to the domain of the feminine. Of interest here, however, is the resistance of the respondent, who, rather than acquiescing to dominant social rules of silence, agentically demands change to counter the negative discourse in which younger students position menstruation, and by extension, their own bodies. Being permitted to take breaks and to use the bathroom as needed was another issue raised. Participants highlighted how they had to respond to embarrassing questions when they needed to use the bathroom during class time. A special mention was made about male teachers' lack of understanding surrounding this issue, where some respondents were stopped from using the bathroom altogether. So quotes like, allow all girls to leave through classes for this reason with no questions. Many of my teachers will not allow any students to leave the classroom for any reason, mainly the male teachers. And another student said, inform male teachers that we should be allowed to go to the bathroom. I have never had a problem with female teachers, but some male teachers seem to forget there's more than one reason to go to the bathroom. Some male teachers also have a problem with girls taking their bags. These teachers should be educated. However, it wasn't only male teachers who regulated students' bathroom access. Let me go to the bathroom to clean up when I have bled through my uniform. A female teacher refused for me to leave the classroom despite blood all over my dress and chair and pleas from my fellow classmates. These quite traumatic experiences really for a lot of these young people. So these quotes highlight the rules imposed on students by teachers whose key role is to pursue the institution's intellectual project and while doing so simultaneously regulate students' bodies. This regulation, however, works against the menstruating body, which cannot be contained, and doesn't abide by institutional regimes around time and place. This inflexibility requires students who menstruate to negotiate the system's rules and expectations, which may result in them coming into conflict with teachers. The negotiation work demanded of young people just to be able to manage their menstruation at the most practical of all levels is challenging, even potentially intimidating, and adds additional burdens to the everyday educational experience of these young people. Another theme that arose was to be considerate. Many respondents felt that their teachers should be more considerate towards them and what they were going through during menstruation. Participants felt that teachers needed to provide the opportunity to postpone tests and assignments so that menstruating students could cope better. Thus, respondents wanted structural change and greater compassion by teachers. To be honest, some of these were pretty simple. For instance, allow us to wear jumpers around our waist to add security from bleeding through and less worries and self-consciousness. Be more considerate and understanding of how much periods can affect you. For example, a teacher once advised me to suck it up and play sport when I complained about the pain. Understanding that it does affect our concentration and ability to learn. It's a serious issue and a lot of us can't help it and we don't want to feel humiliated because we can't focus and seem stupid. So just to conclude this section, menstruation management and pain impacts a significant proportion of the school population. Having a culture that is supportive of menstruators is critical to ensure that menstruating students have equal access and opportunity to education as those who do not menstruate. Most of the suggestions raised by respondents in this research are relatively simple to execute. For instance, the provision of enough sanitary bins in schools to meet the needs so that students have clean bathrooms to use that don't have overflowing bins is just a basic hygiene issue. Uniform requirements could be less stringent to enable menstruating students to, quote, wrap their jumpers around their waist as an extra layer of protection in relation to visible leakage. Schools could make access to menstrual products more convenient and less embarrassing for those students who find themselves unprepared for their period. This may involve providing access to menstrual products from various locations or contact points across the school. These products may also need to be available in all genders and male bathrooms to provide appropriate support to gender-diverse students to use facilities that match their gender identity. Ensure bathrooms are unlocked and available for student use during class time. Permit students to leave class discreetly and raise the awareness of school staff around the issues faced by these young people. Issues around the provision of pain management are more complex. In Australia, schools are generally not legally permitted to administer medication to students. However, explicit education for students about how to self-manage their pain through both over-the-counter medication and alternative therapies, such as heat, may enable young people to create their own remedies. Additionally, offering more support and empathy to students in pain rather than having their symptoms dismissed by staff seems critical. Such pain can be completely debilitating for some students, requiring days off school, as Mike pointed out, and impacting academic performance and assessment. It might be beneficial for schools to develop policies that support students who suffer from dysmenorrhea. For instance, such policies might enable examination and assessment submission dates to be rescheduled. Similarly, participating online from home during a painful period could be made an option for some students. This would allow students to have equal access to learning and keep them at school rather than having to enrol in distance education alternatives. It may also reduce absenteeism for students who experience difficult menstruation and could reduce the need to seek medical documentation, which is also costly, was also mentioned as a cost for some participants. It would also enable students to keep up with their lessons. Finally, mandating exposure to the topic of menstruation through the school curriculum could help to normalise menstruation and facilitate conversations in the home. This would also help to ensure that non-menstruators learn about this area and ensure that students of all genders receive the information that they need. Normalisation through education could also diminish incidences of harassment, stigma and humiliation. Thanks. So Michelle can speak now.
Thanks, Tanya. I'll just sort myself out here and move slides. So following from Mike and Tanya's insights, I wanted to pivot our focus a little and look at how menstruation affects women, girls and people who menstruate at work, and also to talk about the labour market more broadly. So globally, rising female labour force participation represents one of the most noteworthy economic developments of the last century. But despite this increase, little is known about the individual and broader economic costs tied to working women's experiences of problematic menstrual symptoms. And drawing on Mike's earlier remarks concerning how many menstrual cycles women are likely to experience during their paid working lives, 400. So our research seeks to advance nuanced forms of feminist inquiry into economic issues affecting women's working lives, and hopefully will contribute in some way to redressing these existing knowledge gaps. So I wanted to pick up on some of the themes and ideas which Mike and Tanya have both referred to, and that is this idea that women's bodies have been, or how they're constructed in workplaces, so how they're constructed in education contexts and how they're constructed at work. And so owing to women's reproductive capacity, and I say perceived or otherwise, women's bodies are often described as leaky, unpredictable, emotional, and so inherently problematic. And so while women's bodies have been rendered abject, they can also be simultaneously rendered highly visible, and they can also be disciplined in the workplace. And so examples of that are in the case of pregnancy or when leaking ceases, that is perimenopause and menopause. And we see intersections with ageism. So as is the case in education contexts, we see that come through to work, that male bodies are rendered or reproduced as the norm, and the ideal abstracted worker with few external obligations or bodily demands outside of their work takes precedence. And so in workplaces, women's bodies are made to fit, often for the generation of greatest value. And so it's against that norm that women's work performance is determined and is obviously often undermined as well. So the career effects of these normative constructions can be especially challenging for women in non-traditional occupation settings. So an example from a white paper that I led with a colleague, Sarah Duffy, we spoke to members of the Electrical Trades Union, and they note that one of the challenges with women working in the electrical industry is access to amenities. So we're seeing these same themes recur in education work. And they literally had nowhere to go. And so the union is obviously trying to recruit a more diverse workforce. Women represent an opportunity, and yet the absence of clean, safe and hygienic toilets will continue to blunt the industry's growth. Another example, and again looking at particular population cohorts, is precariously employed workers, and often those people are young. And so we spent some time with members of the Retail and Fast Food Workers Union, and they had a campaign called We're Bloody Essential. And what they were advocating was for the needs of young workers. And again, it was the provision of basic things like soap and sanitary products. But what was also quite disarming and alarming about this, and again, we see the surveillance of women's bodies, is that these workers in retail environments and in fast food contexts weren't able to use washrooms. They weren't able to take breaks, and so there was restriction and surveillance. So what we found is that women often seek to then conceal their problematic menstrual symptoms at work. And so they want to seem to be able to work without disruption. And again, as in education contexts, we similarly see in work is that women are wanting to pass as non-menstruating, or indeed, I'll speak to in a moment, people are opting out of work and education altogether. And Mike has used phrases like to push through and to suck it up really resonate when discussing how conditions such as endometriosis, although not exclusively tied to menstruation as Mike has articulated, impact women's working lives. So rather than take time off, and it is often the case that women can't afford to do so, they're suffering in silence. And so our research is hopefully part of illuminating these issues and then similarly looking at how we can redress those concerns. And very importantly, we've had things like a federal government inquiry into perimenopause and menopause, and the absence of policies and supports for women are really problematic. So one of the things that we've sought to do, and as is the case with all of this, it's never done alone. And I was very lucky and remain very grateful to work with Mike and colleagues within the School of Business, including Associate Professor Maria Varua. And what we sought to do was to actually look at calculating the economic costs. And so difficult menstrual symptoms obviously impact people on the micro level, that is the individual, the meso, the organizational level, that is the workplace. And obviously we see these macro societal effects as well. So our current research, which is currently under peer review, considers the costs of presenteeism, which accounts for the loss of productivity at work while an employee is present but not engaging in work effectively, so job performance. And then there's absenteeism, so that is being away from work, and accounts for part-time, but for periods of time away from the workforce owing to problematic symptom management in the case of menstruation. So what we were seeking to do was to determine the prevalence of pain amongst Australian women, those engaged in paid employment and aged over 18 years. And second, we were looking to assess the impact of menstruation on work productivity. So that is both presenteeism and absenteeism. And we were seeking to then estimate what the economic impact of lost productivity due to menstruation is on the Australian economy. And so Nilly has similarly conducted an analysis, and this is a different data set, but we're coming out with relatively similar numbers, and they're large numbers. So you'll see there that it's over 7,000 Australian dollars per person per year. That is for the individual. But when we look at a menstrual symptom prevalence rate of 90%, that is 90% of workers have experienced menstrual symptoms that are problematic, then there's an economic burden of nearly 14 billion Australian dollars. And so why is calculating these costs important? And I think certainly we've talked a lot amongst our research group, and certainly I know this would be the case around equity issues and equity arguments, unfortunately pale to the monetary arguments. So what this means is by giving this a number, we can actually say to policymakers, we can say to organisations, by not accommodating for women's needs as it relates to menstruation and other reproductive issues, there are impacts on your organisation's performance. So notwithstanding what are really important equity considerations, if that isn't resonating with you, then surely in a neoliberal economic context, dollars and cents will. So what we were hoping will come of that is to use that as a basis to sort of say, well, what are some of the ways that we can redress these issues in the workplace? And we see personal responsibilization of these issues, but we also want to see organisations similarly look to how they can enable the work of employees who are experiencing, amongst other issues, problematic menstrual symptoms. So one of the issues that we've been speaking around more recently is the notion of reproductive health leave. And so just a few sort of quick snapshots around what reproductive health leave is. And we know that, again, when we talk about leave, Mike has discussed the fact that that can absent people from the workplace. So we're also going to talk about leave and flexibility. So we're just going to talk a little bit about what that could potentially look like in relation to Australian workplace legislation. And again, foregrounding that this is not without complexity, and our research group is, playing with these ideas and really untangling what might be the unintended and other consequences of something like reproductive leave. So reproductive health leave is a workplace entitlement, providing workers with paid time and work flexibility to treat and or manage a wide range of reproductive health needs, such as menstruation, perimenopause, menopause, polycystic ovarian syndrome, endometriosis, IVF treatments, vasectomy, hysterectomy, and terminations. And so what's really important about this leave, as distinct from menstrual or menopause leave, is that it is gender neutral. And so the entitlement has three interrelated purposes in that it acknowledges how reproductive health impacts all employees across the life course. It provides paid time and work flexibility to support employee reproductive health. And it can really help, and as Tania's talked about in education contexts, normalise discussions of these needs in the workplace, particularly when we know the taboo and the stigma that continues to shroud these issues. So at present, few Australian workplaces have made this pardon me, have made this entitlement available to their workers. But where we have seen it happen is in what we call collective bargaining claims. So very recently, the Victorian Government and the Community Public Service Union Enterprise Agreement has given access to up to 5 days of paid reproductive leave to its employees. And then again, showing the momentum that's building in respect to collective bargaining claims. In May 2024, the Queensland public sector workers also received a national leading 10 days of reproductive health leave. While these entitlements are not particularly the case in private enterprise, we did also see in 2004 as well disability service provider Scope. They became the first Australian non-for-profit workplace to support employee reproductive health leave for its 7,000 strong workforce. So what is problematic, however, with this approach is we see a patchwork of entitlement. So we can see some organisations are getting 5 days, some are getting 10 days. Largely it's government sector and non-for-profit. So Australian unions are very much instrumental in this push for reproductive leave entitlements, and they're heading campaigns like It's for Everybody and It's Only Natural. And again, that's casting a spotlight on the social and economic benefits of supporting employees' reproductive health. So we've talked about the costs. Now we're talking about, well, hey, there's benefit here for the individual, for the organisation and the economy. And so the Health Services Union undertook an analysis very recently, was conducted by the Bank West Curtin Economics Centre. And they found that it would cost employers an estimated $920 million annually to make 12 days of reproductive leave a universal employee entitlement. Critically, though, at the same time, and this is where the return on investment is, the analysis found that it currently costs the economy $26.55 billion in lost productivity every year without such an entitlement. So this means that providing such an entitlement is nearly 30 times more expensive than the leave entitlement itself. So again, the economics of this certainly makes sense. So currently the Fair Work Act of 2009 provides most permanent employees with a cumulative entitlement of 10 days of paid personal or carers leave, what we typically refer to as sick leave. So this leave is available when an employee or when employees are not fit for work due to personal illness or injury, or to care for a close family member experiencing a similar situation or an emergency. So while in some cases reproductive health presents as an illness or an injury, and Mike has spoken to some of those instances, and that would impact an employee's ability to work, the current definition of personal and carers leave means that employees can't make use of this entitlement for all reproductive health issues. So currently, personal carers leave entitlements are unlikely then to extend to medical and other appointments requiring an absence from work associated with supporting the reproductive experience. So an example of that would be leave for assisted reproductive treatment such as IVF. So it's not a legitimate use of personal leave under the Fair Work Act, and women undergoing treatment are neither ill nor injured. So this is where one of the things that Australian workplaces could look to explore is looking at how we define sick leave, or the purposes for which it can be used. And so it could be the case that something like reproductive leave is a minimum employment standard that could be a safety net for these kind of workers. So how could we kind of achieve that in a legislative sense? Well, we can expand the current narrow reasons for paid personal or carers leave to include reproductive health experiences that require an employee to be absent from or unfit for work. Or another way forward is to introduce a separate paid reproductive health leave entitlement for employees annually or on a per annum basis, and recognising that typically where there has been bargaining in this space, the entitlement is non-cumulative. But as Mike foregrounded, we also know that, people don't want to just be absent. They do want to work. They do want to maintain their career. And so we're also cognizant of the fact that we need to be thinking about how we can enable flexibility in workplaces. And we know off the back of COVID-19, albeit that some of that flexibility is being redressed problematically, but people can maintain their employment if they're able to work differently. And so again, this is about normative fit. So recognizing that everyone isn't the same, and that with some very basic accommodations, people can thrive and they can be productive in the workplace. So how might we go about doing that with the current legislative context at our disposal? And I'm recognising time, I'm nearly finished. So currently employees can request flexible arrangements when they're a parent or carer for a child school-aged or younger. They're a carer, as in under the guise of the Carers Recognition Act, are pregnant, have a disability, are over 55, or are experiencing domestic violence, or are caring for an immediate family member experiencing domestic violence. So the addition of pregnancy is actually only just been included, and that's absolutely welcome and a welcome amendment. But as we know, pregnancy is but one of many reproductive experiences. So particularly if we think about things like menopause, it is the case that women experience multiple symptoms. I'm formally in perimenopause, so I'm told by my GP. And so these conditions affect women well before the age of 55. So certainly looking at, well, if we've got an entitlement that if you're 55 years and older, that you can have flexible work arrangements, perhaps there might be some way to reconsider that age demographic. And that's been recognised as particularly problematic in the recent parliamentary inquiry into menopause, where the government has actually been asked to consider amending Section 65 of the Fair Work Act to ensure that women can access flexible working arrangements due to perimenopause and menopause. And there is certainly some bipartisanship support on this issue, including a revision to Section 65. So as I said, while these, recommendations are made in the context of menopause, they certainly can have positive ramifications for women and people who are menstruating or who are experiencing other reproductive health issues. So that's kind of where we're at. We're considering the legislative context, engaging in critical discussions with colleagues across different thought areas. And I might conclude there, 2 minutes to the hour. And thank you very much.
Thank you so much to our speakers, Mike, Michelle and Tania. We've got a lot of questions coming in online and also open to questions in the room. So if anyone in the room has a question, I will come around with the microphone. But we might start with some of the online ones, Badra. I'll bring you the mic.
Thanks, Emma. Thanks all the speakers. And more than questions, a lot of comments came that I asked them to share their experience, and they were sharing that Dr. Bamblatt especially was telling leg pain, PCOS, all body pain. Different people were contributing what they have been through. And 3 days each month, terrible time, and still they have to go to work. And Kirsty mentioning hormonal shifts during menopause, and then the comments that workplace need better understanding, more awareness, all sort of things. And a good question from Dr. Bamblatt is about her daughter is a swimmer on a competitive team, and she sometimes has to miss swim practice due to period pain. Her male coach is unsympathetic. What do you suggest for girls in sports?
That's an excellent question. And I would just like to mention the work of Dr. Kylie Steele. We worked together on some research on this. But basically, that's pretty normal. We found that young women didn't disclose their period symptoms to their coaches because of kind of embarrassment. So it's a really tricky one. I suppose what we had suggested was, if possible, that there is some kind of conversation happening, because male coaches I can't speak for this particular coach, but it's quite possible they don't actually understand the impact that different phases of the menstrual cycle have on performance and how much pain and other things can occur. And often, athletes are very tough, much tougher than me, and they push through. And so often they don't want to speak about it. But I think in the first instance, I would say, having a conversation with the coach and whether the parents. Oh, sure. So I would just say, I was just wrapping up, but I was just going to say, I think what I'd suggest is try and have a conversation with the coach. They may simply not be aware of the impacts, and maybe that's something that the parents could potentially be involved in as well, depending on, if or for younger girls, and they might feel quite embarrassed to talk about it. So maybe having an adult there might be helpful. Hopefully that helps.
Did we have any questions in the room? Actually, I do have a question. And this haunts me to this day. I once heard on the news that a woman was successfully suing her employer, her male boss, because I don't know how, but she must have disclosed to him that she had her period. And then he started making a calendar and tracking her cycle on the office wall or something. And, she sued for this sort of treatment. And I feel that it speaks a little to women's hesitancy to talk about periods, because they can be treated badly or used against them in a kind of discriminatory ways. So finding that balance between it's okay to talk about our periods, but then managing how other people behave. Did you have any comments on that and any of our presenters?
Yeah, concerning and yet not particularly surprising. And I'd probably have to reference Danielle Howe's work and again, looking at that idea around disclosure. And that's what's inherently problematic for people. And I guess, when you're thinking about disclosure, it's while there's a policy and there's processes that you can call upon, the challenge is what will be the response. And so certainly what Danny's work has found is that typically people will just continue to conceal. And I think that's also really important to recognise that that's another labour of menstruators. And Tania really referenced that in her conversations around sort of adolescence, and particularly when people are in that young stage of life. And yet even in sort of workplace context, we're still seeing that same issue. So Danny's work is really very much about education and awareness. And I think that's a really important part of um, sort of shifting the dial. But what we also found was it was very much about that relationality between the line manager and the employee. So yeah, we also found in Danny's scholarship that people were more likely to disclose to a female colleague than they were a male. However, also recognizing that when we talk about what's normal, it was also the case that some women were similarly less supportive than they had anticipated because they don't experience problematic menstrual cycles or they don't experience menstrual disorders. So, yeah, I think it's so important that we're finally talking about these issues. We're trying to redress stigma and taboo, but that is just a prime example, of what is problematic. And I think this is really important. People are experiencing this on the daily and obviously based on those experiences and the things people are putting in the chat.
Thank you, Michelle. Yes, it's so concerning that we can disclose things, but then we have to maybe manage how people respond and for people to know what's an appropriate response. Okay, backtracking, we've got something in the chat. I'll pass to you.
Jess Keeley is asking, some colleagues and I are looking to talk to parents and young people with intellectual disability around menstruation management. Do you have any thought or literature you can recommend?
Yeah, certainly that expertise is falling outside of myself, Mike, and Tania's wheelhouse, albeit that we'll absolutely, following today's conversation, endeavour to assist in some way. What I can say, however, is that Neely Marden is leading a project at present which is actually looking at a Delphi study exploring some of these issues which you're referencing. So that is looking at health literacies and what and how these constructs and ideas should be taught in the education system. And obviously particular cohorts of students will have particular needs. So that certainly is a research agenda and a space that we're exploring. But if we could take that on note and we will certainly endeavour to speak to colleagues across the university that might be able to offer that, that more particular expertise.
There is one more question. Andy Earl asks, it's a comment versus question. Raising children today, specifically young boys or men, is there a good approach to discuss periods, etc. with them to ensure they are accepting and supportive of female friends and partners in the future, making a world where discussion and understanding is more prevalent?
as the token man, I can make a comment on that. So I totally agree, and that's certainly something that Tania and I have been working on with the Menstruation Matters project. So if you have a look at that website, it's actually gender neutral. It's for everybody, and we agree that teaching young boys and men about periods is actually just as important, because it's not, while we continue to see this as a women's issue, it's going to stay, I think, taboo. It's going to stay underrepresented, underfunded. If we see it as a societal issue, this is something that affects everybody, then I think that that's how I view it. The same way as other, conditions that affect people. So that's a fantastic point, and congratulations for kind of, trying to make sure that, your kids are well educated. There's also some other great programs that I'm aware of. So there's one called Period Talk, which I was involved in helping design, and that is specifically for young boys as well as girls. There's also Ped Talk program, which is in various states, and I believe that that's also very gender inclusive. So there's definitely a move now, as far as I can tell, towards that exact thing, is that we shouldn't be splitting classes and saying, boys go here and girls go here. So I think it's just it's a slow process, but it seems like it's happening.
Thank you, Mike.
Thank you, everybody. There are general comments, and some people were suggesting some books and some links while people were listening to this spiel, and they were suggesting go to this site, go to that site, read this book, like that. So which is great, like a lot of good engagement. And thank you.
Thank you, everyone. Thank you for coming.